All right, so Ronnie is in the acute phase of healing because he got that ankle sprain about 2 days ago after stepping in a gopher hole. So we're going to do some ultrasound on Ronnie. Some of the absolute contraindications are active cancer, a pacemaker, and not applying it on reproductive organs. Some of the regional contraindications are a deep vein thrombosis, impaired circulation, and an active bone growth. The indications for this are soft tissue healing and repair, remodeling scar tissue, myofascial pain, bone healing and repair, contractures, and chronic inflammation. So follow me. Let's go check out the ultrasound machine and see what settings we're going to get Ronnie on today. So first off, we're going to click the sound button because we're doing ultrasound. Because we're doing this on the lateral malleolus, we don't want to go too deep, especially because there's bone right on the top and we don't want that to get too hot and painful. So I'm going to select 3 megahertz. And then because this is an acute injury, we don't want to do thermal. We want a non-thermal setting. So I'm going to do a duty cycle of 20%. And then for non-thermal, for a duty cycle of 20%, you want the intensity between 0.5 and 1. So I'm going to choose 0.7 as my intensity. And then you want the time to be somewhere between 5 and 10 minutes. So we're going to do Ronnie for 8 minutes today. All right. Nice to meet you, Ronnie.
Hi.
I heard the gopher hole got you.
Yeah, I did.
Yeah, that is the worst. I would be lying if I said that I haven't had like 10 plus ankle sprains in my life. So today I'm going to try to get this ankle feeling better with ultrasound. Have you ever had that done to you before? No. It feels pretty nice. I'm going to put some gel on your ankle and then just move it in a small circle around the side of that inflammation. And hopefully it will get things loosened up and feeling better. That sound good? But first, there's a couple things that will indicate to me that we couldn't do this treatment. I saw on your chart that you have type 2 diabetes, and sometimes that means impaired circulation in the feet. Do you have any impaired circulation anywhere in your body?
Kind of in my hands, but...
In the hands, but the feet are fine?
Yeah, I can feel my feet.
Okay, perfect. So that should be fine to still do. You don't have any active cancer?
No.
Anything like that? Awesome. And then, let's see. And then you don't have a pacemaker?
No.
Okay, so we're good there. So it looks like ultrasound is going to be a good treatment for you. So to start, I'm going to put a towel on you because this gel gets a little sticky. I'm going to make sure it doesn't get on your pants. And it shouldn't come up that high, but I've got it on me and it just sticks to my skin the rest of the day. So, all right, if it's not too painful, I'm just going to rotate this a little bit. Are you comfortable? Is there anything I can do to get you more comfortable? Because we're going to be here for about 8 minutes. Okay. So to start, I'm going to put a towel under your foot here too, and then just apply some of this gel. A little bit cold.
Yeah.
Yes. And then here's a little ultrasound wand.
Okay.
And we don't want to apply this to an area much bigger than 2 times the size of the head here. We call that the effective radiating area. And so I'm just going to be moving it in small circles around the outside of your leg.
Okay.
If you start to feel any pain or burning, let me know. That means I'm doing something wrong. So I need to change something. So hopefully you don't feel it. You should just feel this soothing thing going around your ankle. You should not feel any burning, sharp pains. Sound good? Okay. I'm going to make sure this is in full contact with the gel before I turn on the machine. And since it is, I'll start. Now it's going. And I'm going to try to not spend too much time right on the bone there, because that would increase the chance of pain for Ronnie. And then I'm just going to want to go in small circles about 2 times the that feel okay, Ronnie? And try ultrasound. And then so now I'll turn off the machine while still having it in contact. And then I'm going to use this towel to wipe off the ultrasound head. And wipe off any excess gel. How are you feeling, Ronnie?
Good.
Awesome. Well, we're going to get you going on a little bit of mobility. Nothing too serious because this is a recent injury, but we'll see if we can get you feeling even better.